Good morning, this is Dr. Tarek. Today I am going to talk about diabetes mellitus. Diabetes mellitus means sweet diabetes. There is another diabetes that is known as tasteless diabetes, that is diabetes insipidus. What happens normally in our body is there is a gland which is known as pancreas gland. It is present at the lower level of the stomach and little bit behind the stomach. It contains cells that are present in groups, and these are known as islets of Langerhans. There are two types of islets: beta cell and alpha cells. Alpha cell produce glucagon and beta cell produce insulin. These two hormones control sugar level in our body. That is what normally happens. When we eat food, glucose level in the blood goes high, which is known as hyperglycemia. When there is hyperglycemia, there is sensor in the pancreas that can sense the sugar level is high. It produces insulin. When insulin is produced, it does two functions. Number one, it helps the glucose enter in the cells of the body, and just like this one. This is a blood vessel. This is a blood vessel, and these are sugar present in the sugar molecule present in the blood, and this is the cells of a tissue. So insulin comes and it helps this sugar particle to enter into the cell, and we know we have trillions of cells in our body. When sugar enter in trillions of the cell in our body, so definitely it is reduced in the blood. Number two, if there is still excess glucose, then insulin convert this into glycogen. Glycogen, and that is the storage form of glucose. Glucose is stored as glycogen in the liver as well as in the muscle of the cell, muscle of the body. So when there is need of glucose, it will be taken from these stores. Number two, we sleep at night. When we sleep at night, we do not eat, and there is hypoglycemia. It goes below the normal level. Hyperglycemia mean above normal, and hypoglycemia mean below normal, and euglycemia mean normal. So when there is hypoglycemia, then alpha cell produce glucagon, and glucagon convert glycogen into glucose, and that bring blood back into the blood. We know glucose is brain tonic. It is also body tonic. We use sugar as a readily available form of energy for walking, talking, everything. All activity we use glucose, and this is a brain tonic for good concentration, for good memory, and for good judgment. Now what happened? This was normal. This was what happened in normal person. Now what happened in disease? There are two type of diabetes. One is type 1. In type 1, this is the autoimmune disease. The body immunity stop recognizing alpha cell, beta cell, sorry, and they destroy the beta cell. When there are no beta cells, so insulin is not produced. So we have to supplement this insulin from outside. Number two, type 2 diabetes, there are many aggravating factors in producing diabetes mellitus. Number one is obesity, inactivity, and there can be family history, and it can be due to race, it can be due to ethnicity. A person is maybe having high lipid diet and maybe having high carb diet and excessive in alcohol intake. These are the different factors which can cause, which aggregate the diabetes mellitus in a person. Next is signs of diabetes mellitus. When signs develop in the blood, when blood sugar rises in the blood, these are the signs that appear. There is frequent urination, increased thirst, and patient has polydipsia, increased drinking. Then increased appetite, patient is hungry all the time, and a patient has polyphagia, excessive eating. So frequent urination, frequent drinking, frequent eating. The skin is dry. The skin can be itchy. A black velvety skin in the neck, armpit, and groin. Frequent skin infection, fatigue, blurred vision, unexplained loss of weight, and slow healing of the cuts and wounds, tingling and numbness of the hands and feet. So these are all signs that develop after diabetes mellitus. Now, next thing is how we can diagnose the patient that patient is suffering from diabetes mellitus. We ask tests that one test is known as fasting blood sugar (FBS). Patient is not eating for 8 hours, maybe the whole night, and in the early morning we can take this test. 8 hours no eating, and in that condition, the adult patient, it should not be less. It should be less than 99 milligram per deciliter. It should be less than 99 milligram per deciliter, and if it is between 100 to 125 milligram per deciliter, this patient is known as pre-diabetic patient. Pre-diabetic means it is no diabetic yet, but this patient will develop diabetes next few years. Then third thing is, if the fasting blood sugar is 126 milligram per deciliter or more, then we can label this patient as suffering from diabetes mellitus. There is another test to diagnose diabetes mellitus, that is 2 hours postprandial blood glucose. A patient eats something, and then after 2 hours we take the blood sample and check the blood glucose level. Normally, in normal patient, it should be less than 140 milligram per deciliter, and if it is 141 to 180 milligram per deciliter, this patient again is a pre-diabetic patient. This patient will develop diabetes in next few years. And if it is 200 milligram per deciliter or more, we can label this patient as suffering from diabetes mellitus. Now the treatment for the diabetes mellitus. For type 1 diabetes mellitus, we know there is no insulin production from within the body. Beta cells are destroyed. Then we can put the patient on insulin right from the beginning. But in type 2 diabetes, we will first try by controlling the diet of the patient, take less carb, and then asking him to exercise or walk. It will work for few years. Then we can put the patient on oral pills. We begin with one medicine, one tablet. Usually this is glucophage. There are two type of oral tablet, glucophage, biguanides and sulfonylureas. Biguanide, as the name is telling, it is for big people who are overweight, and sulfonylureas, they are for other. One of the biguanide is glucophage. So that is the most commonly used medicine, and first of all we give single tablet, and then we give tablets in combination. If they also fail, then we can put the patient on insulin, and then this patient will pass his life on insulin. This was all about diabetes mellitus. Thank you very much.